Ankle injury is the most common leg injury, more common in general population than in athletes. Everyone knows about ankle injury. However, there is a lot of information they actually do not know. There are two groups of ligaments, one on the inner side and on the outer side. So the inner side is a stout ligament, usually thick and then hardly gets injured, and also doesn't allow a lot of movement on this way. Whereas the outer side of the ligament, there are three ligaments which allow a lot of joint play and movements which can turn and twist your feet inside. And these are the group of ligaments usually which gets injured because of a twist injury. The most commonest lateral ligament to get injured is the ATFL, which is the anterior talofibular ligament. And because of the greater extent of movement, we only twist on the inner side more commonly. The inner one doesn't get injured more commonly is because it is a thick stout ligament, not a thin ligament. Commonly, when an ankle injury happens, the person usually suffers from a lot of pain and immediate swelling in that particular area, which could be very dramatic and traumatic to that particular person, and they'll be very afraid to put their feet down and walk. However, not all ankle injuries are dangerous. So it is important for that particular person who has injured themselves to observe for at least a day or two to see what actually happens. Are they able to put their feet down? In case if they are not able to keep their feet down and walk, it does indicate that the injury is slightly on the bad side, and it is important for them to go and see a doctor or a physiotherapist to get it assessed. Ankle hurts a lot because the pain fibers and the nerve endings, so the pain fibers are quite a lot in the collateral ligaments, and particularly because it is a weight bearing structure, so every time you put your feet down you feel it a lot. And also to take note that ankle is a dependent structure, and blood flows down, but it's not easy for your blood to push it up, and there will be a lot of swelling which can accumulate immediately in a couple of hours, which could all compound and be the reason for extreme pain. On a simpler term, I would say that your ankle is that surface of the body or the part which is in contact with the surface of the earth, and that is what which tells your brain where exactly you are standing. It is not that we look down at the surface every time to know where we are standing, what is the type of surface, is it slippery, and all those things. So the information collected from the sensory system, the joints and the foot, is sent to the brain to give you an understanding which improves and maintains your balance. If this is lost, which can be lost in an ankle injury, what can happen is that you will not be able to sending a proper information to your brain, which is what we call as lack of proprioception in technical terms. So it is important for somebody who has had an ankle injury to go and visit a physiotherapist or a sports doctor and understand what has actually happened, and then retrain themselves with proper exercises and proprioception exercises and activities to improve and get back to their skills. If not, then the proprioception will be eventually most of the time lost. The best way to understand is like, in case if you are able to put your foot down and then you can stand on a single leg, close your eyes, and if you're dancing like a drunkard, definitely that you have lost a little bit of a proprioception in the ankle and the knee. You can compare with the other side to know how bad your injured side is affected. It is important to understand what exactly has happened over there. So it is good to visit a doctor, get an image done, or at least be assessed by a physiotherapist to see whether it warrants a doctor's visit, or at least it needs a rehab. The reason is because most of the times these ankle injuries can also be associated with fractures. There could be microfractures which can happen. People just think it is a sprain, but it is not the case. Most of the times there could be fracture involved in that one. Then there is also another condition. It's called as high ankle sprain. It's called as syndesmosis. So these are fairly dangerous because once you lose the stability, it is very difficult to get down. So high ankle sprains are dangerous, particularly in sports. To return to sports, it could be a biggest hurdle for a person to return back to sports. And also an important side factor to note is that most of our foot stability comes from the big toe. So when you have an ankle injury, like for instance in a ligament injury, and if you're not using your big toe for a long period of time, twisting your ankle and loading and haven't put your weight much, that can also lead to loss of strength in your big toes. Your big toe is actually very important in positioning yourself and then getting you to walk and run and then do activities more efficiently. Most of the time, once you know that you have an ankle injury, it is important to follow the basic steps just like any other. It is rest, ice, compression and elevation. It is important to rest the ankle, not to weight bear and increase the inflammatory response in the early time. However, having said that, it is also important to strengthen your knees, your quadriceps, your hamstrings and your glutes during this time so that you're strong enough and then get back to rehab as fast as possible. A rest is not a pure rest, slouching in a sofa. I always repeat this to my patients. And icing is important. There could be a lot of debate going on across the researches. For now, let us stick with ice. Let them come with a proper answer to us. Until then, ice is ice. Compression and elevation is a must in terms of ankle because it is a dependent part, and then it is very difficult for us to create a venous return at this point when there is a lot of inflammatory response happening over. So it can end up with a huge swollen ankle every morning. So compression and elevation when you're lying down is very important. Avoid, even when you're sitting down, lift your ankle and place it on a chair so that the blood flow, it helps with the flow and drains the exudates away. Once the acute stage is clear, then that is the time where we need to draw a map on what exactly is your range of motion, what is lacking in you, what is your strength in terms of your ankle muscles, and especially the everters are lost. Usually they can lose and their muscle power can even go down to 2/5, and it is important to strengthen them. So in the early stages of rehab, you will have to focus on range of motion and strength. And as I spoke earlier, the rest of whole thing would be proprioception. Proprioception when you're standing, proprioception when you're sitting, when you're running, when you're jumping, when you're hopping, when you're twisting, and when your proprioception is excellent, that's where you return to sport. In case you have a niggling injury bothering your ankle for a very long time, or a recent injury in your ankle, it is good to get it checked. And we are here at River Physio. Come see us anytime.